Thank you very much for joining us here at the Chesterfield Royal Hospital today. Can you tell us a bit more about what the NHS 7-day service is all about?
Well, the concept of providing 7-day services has been brewing for a while. And I think it first came to a head when there were a combination of anecdotal reports of people with different types of conditions having a higher mortality at the weekends. But in particular when the hospital standardised mortality ratio was beginning to bite in the NHS. And one of the SHA medical directors for the southeast of England said that he had noticed that when he looked at hospitals that had a high hospital standardised mortality ratio, that it was particularly high at the weekends. So one of the things I do is I'm involved in a research group that meets and does stuff at the weekends. And so we looked at the hospital data for 14.5 million patients admitted during the financial year 2009 to 2010. And we confirmed that finding, that mortality is elevated at the weekend. We found that if you compared patients admitted on a Wednesday with patients admitted on a Saturday and took into account their disease processes and severity of illness, that the mortality was 11% higher on a Saturday. And similarly, the mortality was 16% higher on a Sunday. So it began to look as though there was a problem. But interestingly, if you were already in hospital, the mortality was below the week, so you were perfectly safe. But the elevated mortality, interestingly, also extended to patients who were admitted as elective admissions and those who were admitted as emergencies. So that's raised some questions. Meantime, there were other things going on. So we were starting to hear from surveys conducted by the General Medical Council, the BMA, Medical Education England at that time, work conducted by Professors John Temple and John Collins for Medical Education England. The junior doctors in hospitals were feeling stressed at the weekend because they had a lot of patients to look after, and medicine now is much more complicated than it used to be. And secondly, that they were feeling unsupported by both senior medical staff to help them make decisions, and also that they didn't have access to all the tests they needed to make some of the decisions that they had to make. So there were two questions that came out of that. One was, did this lack of senior decision-making and lack of access to diagnostics underpin the elevated mortality at the weekends? And secondly, in my mind, it raised a whole set of questions about, in the context of the European Working Time Directive, are we training our next generation of doctors well if a substantial bit of their training is happening at the weekend when they're unsupported? And then finally, we started to hear from patients groups that there were emerging concerns about access to NHS services at the weekend, not just in hospitals, but also in primary and community care. But it would be easy to just turn this into a series of criticisms for the NHS. But I think it's a great opportunity for us, because one of the things that the research group that I'm involved in did was to look at 190 not-for-profit academic health science centres in the United States. And the elevation of mortality at the weekend was absolutely identical to this country. So it tells me that this is a problem which is a problem of Western healthcare systems, but it is one that we in the NHS are uniquely positioned to solve. In fact, we are the only healthcare system that has actually decided to address this issue.